Welcome to Chapter 6 of the Platinum Planner Preceptor training program called The Clinical Experience. In this chapter, we're going to cover 6 objectives. Cover 6 objectives, which are differentiating between clinical performance and field internship, basically a strategy to guide students through the different phases, maximizing the impact of the experience, implementing a case study method, and also reviewing what happened, adequately debriefing after a situation, and how to effectively work with the, quote, difficult student. Clinical experience versus field experience. What is a clinical experience? We define a clinical experience as anything outside of the classroom or lab, basically interacting with real patients. Differentiating between a field experience and a field internship. Clinical is anything outside of the classroom. Field is typically EMS time. There's field experiences and field internships. Field experiences are done basically focused on skills out in the EMS setting. Field internship, though, is more patient management focused. So I'm not as caring about the skill as I am the ability for this student to manage the entire scene, including care of the patient. Field experience is typically acquired earlier on during the clinical experience. Field internship is supposed to occur after most of the cognitive and psychomotor portions of the program have been covered. Guiding the student through the phases of the clinical experience. So the new clinical student, hi, welcome to your first clinical shift. How do you feel? I feel really nervous. I'm kind of uncomfortable. They may display this nervous and uncomfortable by being inappropriate and or a klutz. And typically this student's going to need a lot of direction. They're new to the area, everything's new. They don't even know where the bathroom is. So we continue on then. As they gain an experience in the clinical setting, they may develop a false confidence. Typically they go through a number of phases. They're incompetent and lack confidence, and we hope to get them to be both competent and confident when done. In the middle, they go through 2 phases. The first phase is actually kind of uncomfortable, as the student is incompetent but feels confident. So that's that false confidence we talk about. It's there that they're the scariest, because they'll think they can do something when in fact they can't. They'll then go to another phase. This is the third of the 4 phases that we just mentioned, where they're feeling competent. Where they demonstrate competence, but they feel a lack of confidence. They're nervous about what they're doing. This is when actually their lack of confidence can cause incompetence. So as a student progresses through these phases of lacking confidence and competence to acquiring both confidence and competence, we want to move them along at an appropriate rate. We don't want to push them. And we want to involve the student in the direction once they're experienced. So what would you like to do? What would you like to focus on? When they go to the transition to field internship, so they're no longer doing their clinical or field experiencing, and they're now interning, we want to make sure they're ready. You don't want to put somebody in an internship role when they're not ready to lead. It's here where we want them to make safe mistakes. People learn most or best from their mistakes. We have a feeling of wanting to jump in and take over, because most people in EMS and in the hospital setting tend to be somewhat control freaks, which is correct, because we're our patient advocate. But we also have to allow that student to learn to take control also. And if we continue to take control from them, they'll never learn to control. So we have to allow them to make safe mistakes. You got to keep a careful, watchful eye on them. And as they're about to make a mistake, you have to quickly decide, is this going to be a safe mistake or not? Now, as they're at this experience, we often have downtimes. We don't have any patients. Our census is down. We're not getting any calls. So during these downtimes, these are great times for the students to be studying or working with equipment, or asking you questions, or just going over the rig, or going through maybe a piece of equipment that they're not experienced with in the hospital setting. This is not the time for them to catch up on a nap or to call friends or to text their buddies. At the beginning of the shift, maximizing the experience. When they get there, they help do the rig check. They help do the shift transition. From the moment they get there to the moment they leave, it should be an educational experience. So at the end of the shift, we want to make sure we review with them. What did we cover? What did we do? Was there anything that overall that we learned today? What was the best thing you learned? Case studies and review. Every encounter that this student has should be reviewed. And it can be reviewed again with a student focus. How do you think that went? Or with an instructor-directed focus or a preceptor-directed focus. Here's what I really liked what you did. Here are things where you can improve. Again, end on a positive. I really like that you did this, etc. Another thing that's worthwhile is create case studies or scenarios. So if you're not having any calls today, create a case, create a scenario. If there's patient census is low, ask, what would you do if a patient came in displaying these things? What would you suspect? What would you want to assess, etc. Debriefing the student. And this is dealing with times when situations happen. Bad things happen to good people. So something bad has happened. Maybe an infant has been failed to be resuscitated. So let's review the facts. And we got there, the kid was stiff. When the patient was brought into the hospital, someone had already worked with them quite a long time. They were stiff. Review the feelings. How did you feel about this? How did the patient feel? Go ahead and talk it out. Also relate to the standards. What would the standard have been in this case? Allow them to see the big picture. So often we get focused on the little things that we lose sight of the big picture. And if it's a really, really bad situation, seek assistance. Each of the services, each of the hospitals, all the clinical and the school all have further assistance when needed for these students when, quote, situations happen. So let's make sure that we take advantage of those resources. Now, dealing with the difficult student. So this is the student who you're just not getting the right vibes from. Again, as we look at our picture here, we see somebody, how could you not get along with this person? They're smiling. This just looks like somebody you could interact with well. But there might be some problem that the interaction with this student and this preceptor just isn't going to work well. Typically, the key part is to start off, try to identify the cause. Is it a power struggle? Is a student feeling inadequate? Is a student seeking attention? Or is a student seeking revenge? Maybe they perceive if they've been slighted by this person before. Maybe they're bored and want attention. Maybe the student really feels incompetent or inadequate and is just looking for positive feedback from that preceptor. Or maybe it's a power struggle. It's sort of like that adolescent as they're dealing with their parent. When you're dealing with the difficult student, enlist their help. Ask them if it's a case of revenge. If that's what you suspect, say to the student, what did I do to you in the past that's caused you to feel a need to lash out? Have them help you help them. And then again, you have other folks that are willing to help you. The instructors in the program, other preceptors who may have experienced the same thing or had issues with the student. And this is how they were able to resolve them, and then you now have an avenue to travel down. So in review, as we look at what we've covered, we've talked about differentiating between clinical and field experience. We've talked about implementing a guide through that clinical and field phases, helping them move along through. Maximizing the impact, what to do during quiet times, which is basically keep them busy, keep them going on stuff. The value of reviewing the day, implementing a case study method or reviewing what occurred, adequately debriefing after situations, and enlisting the help of everyone when you encounter that difficult student. This covers and completes Chapter 6. Thank you for your time.